welcome back for the first time this year, our resident GP, Dr. Cate Mills. Welcome.
Thank you. Nice to be here again.
Dr. Cate Mills, we're talking diabetes. What is diabetes?
Well, diabetes is a really common condition in New Zealand, and it's when your blood sugar level is elevated. So for most people, their blood sugars would run most of the time between 4 and 8, but people with diabetes, they commonly run above 8. And can sometimes, get at 10, 20, even 30 for some people, which is really, really high.
Okay. Does it affect some parts of the population more than others?
So we see, well, there are two types of diabetes, type 1 and type 2.
Yep.
And type 1 is the type of diabetes that you find in young people.
Okay.
It can be diagnosed in children and teenagers and young adults. And so those are people that live with diabetes for a large part of their life. But there are more people with type 2 diabetes, which is diabetes that people get as they get older, and is commonly found in certain subsets of the population more often. So in Māori and Polynesian people we see it often, and in the Indian community we see it a lot as well.
Okay, what are the more misconceptions you find with diabetes?
So I think the commonest misconception is that people think that if they eat lots of sugar they're going to get diabetes, and that's not true at all. To get diabetes, it's mainly determined by your genes, so it's kind of programmed into you, but a little bit by your environment too. So there are some things like being overweight or a lack of exercise that can bring it on earlier, but by and large it's actually determined by your genes. And so that relates to the cause of diabetes, which is when we lack a hormone in our bodies called insulin.
Yep.
And that insulin is a really important hormone because it tells the body to take the blood sugar and put it inside the cells so the cells can use it as fuel. And if we don't have enough of that hormone, then the body's blood sugar level stays high. And that hormone is made in a small gland deep inside the stomach called the pancreas. And people get diabetes when their level of that hormone insulin becomes low.
Okay, what are the symptoms of diabetes?
So quite wide-ranging. Some people can have diabetes. In fact, a lot of the older patients I diagnose don't have any symptoms at all. They're completely unaware that they have it. But some people will find that they're very thirsty, that they want to drink a lot, and then they go to the toilet a lot, to pass urine really often as well. They're often quite tired and easily fatigued, and sometimes lose weight prior to the diagnosis being made.
Okay, what are the dangers of leaving diabetes untreated?
So having a blood sugar that's high for a couple of days is not going to harm anyone, unless it's super high, and then it can make you really sick. But if it's just, say, slightly above 8, 9 or 10, then you wouldn't really notice anything and it wouldn't harm you. But it's only when it's been high for a while that it starts to damage the inside of the blood vessels around the body. And it damages the most sensitive blood vessels first. So those are the blood vessels in, say, the back of the eye. So it can cause damage to the eye, which interferes with people's eyesight. And so that's called a diabetic retinopathy. It damages the small blood vessels in the kidney, so it can cause kidney problems and eventually kidney failure. But it also puts you at risk of having other blood vessel diseases like heart attacks and strokes and other circulation problems.
Okay, how can people reduce the risk of contracting
getting diabetes?
Yeah.
Well, maintaining a good body weight is a really important way. So we now identify that there is like a pre-diabetic condition, like there are some things that happen where you become what we call a little bit glucose intolerant, and it's a stage that happens before people get diabetes. And if you can identify that time and get somebody to increase their exercise and decrease their weight, they can actually prevent themselves from going on and getting diabetes.
Really? I thought that,
It's quite exciting.
Because I never imagined that could actually happen like that.
Yes. So it can be controlled by the control of your body weight and what you're doing and eating.
So it's just finding out, really early
time
that you are susceptible to diabetes and dealing with it immediately.
Yes. Yeah, and taking sort of healthy lifestyle preventative measures
Yeah.
that will stop you actually going on to get it, which is quite exciting. Yeah.
Yeah.
But once you have got it, once you've been diagnosed with it, there are lots of different ways of managing it. Some people manage it by diet alone, by being really careful about what they eat
Yeah.
and the types of sugars they eat. Some people require tablets,
Yeah.
and other people require injections of insulin to manage their diabetes.
Okay. What advice can you give to family members who are dealing with someone in the family who's just developed diabetes?
I think it's really important that the whole family is aware of what diabetes is, and that's about educating the family, because once that person has to make healthy lifestyle changes to their diet and their exercise and giving up smoking and decreasing their salt intake, it's actually really beneficial for the whole family to be involved in that. And so if the whole family is supportive of their new diet, then it's much, much easier for them to make the dietary changes they need in that sort of supportive environment. It's also good for the rest of the family because it helps them have a healthy lifestyle as well. So it can be a good change for a whole family and a really good way to support somebody with the diagnosis.
Okay, thank you very much, Dr. Cate Mills, for coming in today.
Really welcome.
Stay with us, there's lots more to come on City News.